Hello, everyone. Welcome to a special edition of Speaking Moistly. With me on this Thursday afternoon is Dr. Patrick Phillips. And thank you so much, sir, for making the time to come and chat with me. How are you?
I'm doing well. Yeah, thanks a lot for having me on, Mark. It's a little
Awesome.
surreal. I'm a big fan of your show, so
Oh, thank you very,
it's an honor to be here.
thank you very
Yeah.
much. Like I said, I appreciate your time. So I have, let's jump right into it. We were talking just briefly in the green room about my experience with my doctor. And so just to bring everybody up to speed, I got fired by my doctor I feel like it's for asking questions, but she wrote me a registered letter that states the reasons for why I was fired, which are not, you asked too many questions about COVID. That's not why I was fired, but it kind of, well, the whole situation was jarring. It was really jarring. But I'll explain it. Essentially, what happened was you're a doctor, and you have said on Twitter that the CPSO has given instructions to doctors, and you shared documentation to that effect. Is that accurate? Mm-hmm. Yeah. And so
yeah.
If you can explain. Yeah.
Well, I mean, they share a lot of documentation with us. So the college has a lot of different things. So they have policies in place which are a little more strict, and then they also offer guidance to the profession, right? So
okay,
sometimes they're more loose recommendations that they put in place. So yeah, it depends what you're talking about. If you're talking about the doctor-patient, like ending the doctor-patient relationship, there is a policy.
Oh, there's a policy for that. That's interesting.
There's a policy, yeah, so, which basically is mostly to regulate doctors and prevent them from arbitrarily just firing patients they don't like or
interesting.
I didn't it's there to protect you, not to protect the doctor.
Interesting. Okay, well, that's something to explore. No, I was talking, so I was trying to find out if my doctor had guidance issued by the CPSO, which is guidance that you pointed to on Twitter regarding COVID. And so, like, I was going to my doctor to discern if this information that I'd heard online was accurate and true. And I believed it to be accurate and true. And basically in that series of questions, and I didn't get to ask about the CPSO guidance. I didn't even get to that point because it got so heated. But in the series of questions, trying to figure out, are these things that I'm hearing online? Because I didn't want to be accused of making a decision on the vaccine just based on what I'd read online. I wanted to talk to my doctor about it and see, like, is what I'm hearing online true, right? I said, is this mRNA vaccine the first one that's ever been used on humans? And it took, I think, 2 times that I asked that question before she said, like, yeah. And so I was like, okay, how? So there was a whole bunch of questions that I had, and it ended up that she hung up on me, which I thought was not very good for a doctor-patient relationship. I thought, that's weird, because I'm just trying to figure things out. And then I got the registered mail a week later, but it was sent the same day. So the things that are happening, like my little story doesn't really have much to do with you, other than you're one of the questions. You have a hand in one of the questions that I had for my doctor. And I just think that it's really interesting what's happening from a perspective of somebody who, I'm just a talking head in my garage. I just look at what's happening and I talk, and I'm looking at this, and people are losing their jobs. Healthcare workers are being fired. You've got consequences for not backing down. And I think, what's happened? Like, what do you think about that? And not from like just from a personal standpoint, like from a citizen walking around Canada, what do you think? Like, what's happened?
Yeah, I think our society is in a very dangerous place. I think we honestly are in what's kind of a mass psychosis, and it's something that is not new. It's something that's happened in societies around the world, like plenty of times. It happened. Not just Germany is one example. The other one is the Russian Revolution, the Cultural Revolution in China. It's a phenomenon that's well known in human psychology and sociology, where they're basically sparked by a lot of misery. So if people, so like economic crashes in Germany, it was the bankers devaluing the money because of the Treaty of Versailles to pay off their debts.
Yep.
So everybody was poor and miserable. And then some people can come up and seize a lot of power out of that misery if they can convince people that I have the solution, right? I know how to get us out of this. And if they, especially if they vilify a certain group. So a lot of times, a lot of people gain a lot of political power through threat of war, right? So in a country, they're like, oh, we're going to get invaded. You can think of like Israel, for example. They're kind of a totalitarian state as well, and they keep their people in fear of being invaded and annihilated by the Arabs. And that's happened in a lot of countries. In this case, they're using a health pandemic. They're creating fear, they're creating misery as well through the lockdowns, right? The social isolation, the loss of your job, loss of hope for the future. People are like so distressed. And now what they're doing is they're seizing power by vilifying the unvaccinated and saying they're the source of all your problems. They're the reason you're not able to go see your family. They're the reason you lost your job. And so they're channeling all that anger, that legitimate anger, like from all that social isolation and misery towards the unvaccinated. And what we're seeing is happening society-wide. And when this starts to take its course, we start to become unhinged from reality. But what happens is when everybody's on that same course and that same like herd mentality, because everybody else is doing it, it seems like it's okay, right? So like with these vaccine mandates, like all the universities at once are just firing students, firing faculty for not getting a vaccine. That's clearly against the law. And anybody a year ago would tell you that that is against the law. The law has not changed, right? But what we're seeing is they're just doing it left, right, and center because they're seeing everybody else doing it. So we're also seeing this with physicians. And it's even though the CPSO, who I can tell you is not on the right side of history in this pandemic, even the CPSO has stated very clearly to the medical profession, you are not allowed to fire or deny in-person medical care to a patient for not having the vaccine, and you can't even deny it if they don't get a negative test. You still can't deny it.
Wow.
So
okay.
Even
well,
the CPSO has said that, right? Yet doctors, I'm hearing stories and even official announcements from doctors saying they're refusing to see unvaccinated patients. So like that's like there's so much evidence, right, that we're in this herd mentality, like this mass psychosis, because they don't even care. Like they don't care what the law is. Right?
I saw a documentary this morning. I was at the dentist and I saw a documentary this morning where dolphins will draw a circle around these fish and the fish all panic and they jump. And then the dolphins are like, jump into my mouth, please. Right. And like we've had a circle of mud drawn around us and we're all panicking. And those who keep their head, tend to get through it. But, I tend to agree with you that we are seeing a social or some kind of social panic. People are responding to the media as well, as if it's like an immediate threat, when really in a pandemic, do you fire the people who've been working for the last year and a half, going to work in danger? If you believe everything, do you fire those people?
No.
What kind of madness is that, right?
Yeah. And you can feel the energy behind it, right? This is not like, I can tell you because it's happening in my hospital, like at least with like testing mandates and everything that way, or discriminatory testing. But the energy behind it, if you feel it, it's a punishment, and you didn't do your part, right? So you don't deserve to have a job anymore. It's not a like, oh my God, what can we do to help this health condition? How can we stop COVID? It's not that. It's more it's more of a punishment, angry tone to all of these mandates, right? Like get in line or get out, right? Is what they're saying basically.
It's certainly, and they are fostering that, and that's it's so palpable, right? Like you can, like you're saying, like you can feel it, right? And and it's like they feel well. I mean, you can see sometimes the people there was a woman in Saskatchewan on TikTok saying that they gave her a commode, like a rolling commode, because she was unvaccinated and they didn't want her using the public toilets. And I thought, what? Like, that doesn't make sense. If you believe that COVID is like a gray water, like born disease, why would you want to have open like a bedpan with anyway, right? Like,
I know.
like
No,
it just doesn't, it doesn't pass
yeah.
logical sense at all. So,
No.
and I'm not very, like, I'm not medically whatever, but I can like connect 1 + 1 is 2. So what is the feeling? What is the feeling in the hospital? I've spoken to some doctors. I've known some doctors in my day, and they're saying that there's a lot of doctors. You were just describing almost a feeling of like you deserve to lose your job because you didn't do your part. They're saying, man, those unvaccinated people, right? Is that kind of the feeling in your hospital as well? Or is there a lot, is it 50-50? Are there people who are skeptical of this?
I don't know. I work in a pretty small hospital. I'm kind of the main doctor who kind of worked in at least part of our hospital. And that's not the feeling that I got from most of the nurses that I work with. Like, we all kind of are on the same page. But I think it's a bit of an anomaly from what I've heard from other doctors who work in other hospitals. That very much is the case. Like, they kind of see the unvaccinated as the cause of the pandemic, which is not even true.
Yeah.
But yeah, I haven't seen that with my own colleagues that I work with, but the hospital administration, it kind of feels that way. Yeah.
Interesting. I had a question that I thought was good, and then it jumped out of my head. When you are looking at like what's next, if you were to game this out, so like 6 months ago, I was saying like, it looks like we're going to it doesn't look like they're unwinding this. It doesn't look like we're going back to what normal would have been considered in 2018, whatever normal is. Yeah. It doesn't look like we're close to that. Oh, this is what it was. Vaccines at 80% compliance. What's a typical flu year compliance rate like in your hospital? Like 80% is unbelievably high, right?
Probably less than 50% for sure.
Yeah. So I heard
I don't even know what the actual numbers are. It's definitely not 80%. I can tell you that.
Yeah. So if you have a vaccine that 80% of people take, I have a hard time believing that we're worse this year than last year, and this is a good thing somehow. Like, this is totally expected, nothing to worry about. We don't need to think about this. Just shut up and take your jab. Seems really strange, doesn't it? Like, I'm not a doctor, but you are. Like, so
actually there was actually a study that recently came out. It looked at basically jurisdictions around the world, so looking at countries or provinces or places like that, and looking to see, okay, in these places that got high levels of vaccination, is there a statistically significant difference between those with high vaccination rates or low vaccination rates? And they found there was no difference. There was no improvement. And we can see that here in Canada. You look at Alberta, right there. Last year, like, they had, a year ago from now, they had like next to no cases in September. And now I think they have thousands. Even though like 80+% of them have been vaccinated. Right.
Yeah. So, well, New Brunswick is another good example. They've got, I think they hit the 80% mark, and they've got more cases now than they've ever had before. And it's, so you have to wonder why aren't there smart people saying, we see this pattern, it's concerning, or here's the reason it's not concerning. But like a lot of the times, and I mean, I'm a skeptical guy, so, but a lot of the times when they say, here's 9 reasons not to worry about the supply chain, right? And you're just like, well, hold on a second. I can understand what's happening here. There are things to worry about, right? So like, sometimes it seems disingenuous when they say there's nothing to worry about. So, right? Is there?
Yeah, there is. I mean, definitely. There's a lot to worry about with these vaccines. I think as far as the rise in cases, what there is to worry about is this government control, because the big thing, especially with COVID itself, is that we have so many treatments available. Ivermectin, it like reduces the risk of death from dying from COVID from like 50 to 70%.
Yep.
right? And it's not only ivermectin. We have hydroxychloroquine, which was vilified because Trump supported it, but actually
Yeah.
it's backed by a lot of scientific evidence. It's not quite as good as ivermectin, but it is effective at treating COVID if you use it early.
Yeah.
We have like something like 10 different medications that have been shown in the evidence to be meant to be beneficial,
Well, there
and we're
was,
not promoting any of them.
yeah.
We're
Did you see?
blocked from giving some.
Yeah. Yeah. So I heard about that and I wanted to ask my doctor about that as well. I, I wanted to know what is the outpatient treatment? If you get a positive test, what I basically understand is the doctor says, congratulations, go home. And that's it.
Yeah,
Like,
no, it's honestly it's medical negligence. It's basically state-sponsored medical negligence, right? Because
yeah,
that is the official line. That's what we are told to do, is that if you get COVID, even if you have like risk factors, even if you're 70 years old, we say go home and wait for it to get bad. And
wow.
if you're young and healthy, it probably will just get better on its own. That's the truth. But some people, and we know who they are because we know the risk factors for severe COVID, like we should be treating them, because it's criminal just to send them home until they can't breathe anymore, and then
Yeah,
we bring them into the hospital,
yeah,
put them on a ventilator,
yeah.
which has been shown to actually increase mortality.
Yeah,
Um,
I've seen that as well. Right. And that was
yeah,
another question that I wanted to ask my doctor. I was like, what's the, but regardless. So
yeah.
did you see there was a doctor who was an ER doctor. He prescribed ivermectin to his patients. And this is out west. And he gave a
Mm,
speech in Edmonton. Did you see that speech?
I
Doctor,
did.
yeah.
Yeah.
So I was glad, because I don't like to spread misinformation. I really don't. Like, misinformation is terrible. And who knows what's true these days. So I was
Yeah.
glad to get confirmation that this man, A, was real, and B, what his experience was shocking. So he described a situation where he prescribed ivermectin for his patients. He got a call from a regional supervisor, or like one of the people in charge of AHS, or one of the lieutenants of AHS, to tell him that
Yeah.
he can't do that. He can't give ivermectin. He did it anyway, and then he was relieved of his. He got taken off the job, done, replaced by a doctor. And
Yeah.
they didn't give them inhalers. They didn't give them vitamins, no zinc, no nothing. We know these
Yeah.
things work because other countries are using them. Ivermectin has good results in that Indian province that I can't remember.
Yeah.
And so it seems like I tend to agree with you, and I can't explain why our government would possibly do this, other than to get into conspiracy theories. And
Mhm.
like why would any government do this, right? Why would any
Yeah.
government that's trying to get things back to normal, why would they do
Yeah.
it? Right? Like
Yeah.
I'd love like Doug Ford to be like, oh, here's the 3-step plan, right? Like,
Yeah. 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 I mean, I think it just kind of goes along with this same herd mentality, right? That
mhm.
they're just going along with the narrative. Because if you think about it, it makes so little sense when you put the picture together, right? It's
Yeah.
like, because if you look at the lockdowns, like we're willing to like fire people from their jobs, we're willing to lock them up in their home to the point they become suicidal. We're willing to crash our economy to the point where we'd be able to pay for healthcare anymore.
Yep.
So we're willing to do everything, no matter how reckless it is, to stop the cases, right? When you think of the public health measures.
Yep.
But at the same time, we should not give people vitamin D. That's dangerous, right? Like
Yeah.
that's what they're putting out there, right?
Yeah.
Vitamin D, which has been shown again to reduce mortality in COVID and reduce ICU admissions and prevent severe cases. It's something that's so safe to do.
Yeah. Yeah.
Yet that's being considered as dangerous, right? Oh, ivermectin, which has been given billions of times around the world.
Yeah.
It's one of the safest medications, safer than aspirin and Advil, as far as the amount of deaths that are attributed to this medication.
Yeah.
Yet that's dangerous to prescribe that to patients. They might not get vaccinated, right? Like,
It's crazy. It's crazy.
That's what it is. Like, if you think about it, like if they're like, oh no, we need to be cautious. Like they were not cautious at all with any of these public health measures. Like they're harming people's health left, right, and center.
Yeah.
Why should we trust these people when they say, oh no, we need to be cautious about these other medications because they might be harmful, but we actually know scientifically that they're not.
Yeah. Well, and so that's it, right? Like scientifically, if you cover children's faces, that's really bad. If you do that, if you suffocate children, bad. If you remove their ability to get feedback from other people's faces, that's just as bad. And so
Yeah.
like, we're damaging children, we're damaging our economy. If you drive through, like, man, it used to be you could drive up in Muskoka and get ice cream in a little corner store and it was worthwhile to do it. Now it's like, it's like a desert out there. There's not a lot of options. And so this is not better. Like, they've sold us on, making things better, build back better, if you want to use their term, and it's garbage. But just to give you a sample of the rhetoric they're using to sell us on this, and what they've done is destroyed everything. Like, and I've just given 2 examples, and I could honestly go on all day, but I don't have time. But like, holy smoke, right? How, like you said, how can you believe these people? I say that every day, like every day. I'm like, I wish I believed that we were on the right path, but I feel like if we were lost in the woods, we've got like 4 idiots making the decisions at the front, and they're ignoring all of us, saying we've passed this rock 9 times. Right?
Yeah, it's true. And we have people trying to yell it from the rooftops. We have like Dr. Robert Malone, right? There's a lot, like a lot of doctors who are actually speaking up. We have the Canadian COVID Care Alliance. We have Dr. Ira Bernstein in Toronto, right, who went to the Rome Summit. But what they do is they just try to shut them down, right? Because the other part of this too, and that's why they want to control speech so bad, is that a mass psychosis you don't need to get the majority on your side. All you need is a vocal opposition of probably like 5 to 10%. And what that does is, once people hear like a questioning or an opposing narrative from enough people, they'll be like, wait a second, we should calm down and figure this out, right? Like, oh, this is not just. Because what happens when you have a crowd running away from a fire but towards a cliff, the first person that stands up, they're considered dangerous, right? No, we're running away from the fire or from the wolf or whatever, right? He's like, no, I'm not going to go. We're running off a cliff. But when 5 to 10 people do that, then they're like, oh, it's like a part of human psychology. Once you reach that certain number, the crowd will immediately stop, right? Okay, wait, no, this is not just some fringe guy who's completely wrong. Right? So that's why they try to shut you down early. That's what they're doing with me a little bit too. Because once enough people start speaking out publicly in the public consciousness, it will break that spell and people will start to question.
I don't know how that looks, because right now, even if like, and there's certainly people who are interested in waking up and saying there's something amiss with what's going on, and I can't put my finger on it quite yet, but there's something not sure, not really on the up and up about this. But I think you're right, not enough people are questioning, and the vocal majority is blaming the anti-vaxxer, blaming the person who's, keeping us in this mess or whatever. And I think it's an easy scapegoat for the politicians to foster that and continue to play us off of each other. So how do you heal this gaping hole? How do we start coming together and figuring out the way forward? Because like, we've got to figure something out. Otherwise, like, we're just going to, like, the quality of life and everything is going to continue to deteriorate, and we'll be so lost in the weeds, we can't put it back together.
So I think the key is honestly that we kind of have to roll with it in a sense. Like, I don't really think the hope is in trying to cling to the way things were. I do think things are going to change, and they're going to change drastically. But I'm not saying they need to change in the way that the globalists want them to.
So you're on the Bitcoin side.
Kind of. I actually don't trust Bitcoin that much, mostly because it's crackable. I think that's the big thing. That's what they want. I think the globalists kind of want Bitcoin to thrive a little bit, because then eventually they can install a tracking system on top of it. But yeah, I agree. Yes, in some sense of creating new power structures. And so I think what we're seeing is and we see that with almost any tyrannical system, is that they shoot themselves in the foot. These institutions and these people who are clamoring for power are more than happy to destroy everything along their way to do it, right? And like to destroy the city, and so that they can rule over the ashes, right? Like, so inherent in this kind of clamor and this fear-based consciousness is kind of the seed of its own destruction. And so I think we're seeing like the university system kind of, I don't know, like I think the writing's been on the wall for the education system for quite some time. I think
Yeah.
this whole prison for children kind of system that we have, right, where it's like everything is just so rigid, and you don't remember most of what you learn in school anyway, right? You learn to
Yeah.
read and write, and you learn to kind of socialize, but most of what you learn in school you don't really remember.
Yeah.
So, and I think what the education system has become in like the Western world is not so much about learning things. It's more about getting that ticket, that piece of paper, right? That
Yeah.
says you can move on to the next stage, right?
Yeah.
It's more of a power-based institution, I think. I think the research that a lot of universities and everything do is very valuable and needs to kind of continue in some way, but I think this whole power-based ticket, get your piece of paper, kind of that's your ticket to your being able to earn money. I think kind of needs to go and needs to go to a learning-based system. But
Yeah.
so I think, yeah, I
It's
think it sorry.
Well, I was going to say it's interesting in Ontario where the trades aren't encouraged more. You know, like I think that there's a big, if you can see, or if you can help your kids see the value in something like trades, like becoming an electrician or a plumber. I was so I worked in children's mental health and worked in education, and a buddy of mine back then, 20 years ago now, which is crazy. When we all worked at a residential treatment place, and he decided he was going to go apprentice to be a plumber, and he was like, oh, it'll take 3 years, right? And whatever. And I thought, man, 3 years, like that's forever. And I didn't realize, well, I did realize, like he was going to be making like about what we were making there to apprentice. And then like once the 3 years is done, he's making, you know, quite a lot more at the time. And he never looked back, right? He loved it. And if you can find that kind of niche and take advantage of it, rather than being swayed by the, you know, the ticket, as you were referring to it.
Yeah. And I think that's the thing, like, yeah, if like, as far as learning skills and learning valuable information, that's essential. I think we definitely need an education system as far as that goes. But I think especially like the public school system kind of is a cookie cutter system that is kind of teaches blind obedience, right? If there's one lesson you learn through that, and I think that has a negative impact on our society, right? Because I think that's what it programs into people, that when an authority tells you to do something, you just listen.
It does. It really does. And if you don't listen, like that, you get punished. Like there's a real consequence. And like schools are kind of funny because like the principal is it's a very, very clear hierarchy, and the students are at the bottom. And like I've been in staff, and like I'm talking more elementary school, but I've been in staff rooms where there was a disconnect between like the teachers remembering that like they're there to teach students. They're not there to be liked. You know what I mean? It's they're almost adversarial, the way they speak about the kids. And I'm like, man, like this is a sick school when I hear that kind of language in the staff room. And it's like, oh, so education was getting really, really tough. And I left in 2015 because it wasn't really safe. And they removed the tools to demand, to make sure that you could get kids on the right track. Like you didn't have the ability to really make them do what you needed them to do in like an education setting. So you were just standing there being like, please, like I've got nothing else. Like,
there's nothing you can do. It's kind of powerless.
Yeah. Right. It's like, okay, well, you know, so yeah, it's a very, very strange, man, it's a very strange thing to live through. And it's not just COVID. Like it's been like, if you look back at even the media, even the media of the past 10 years, since 2010, even probably before that, but since certainly 2010, like the focus on what they focus on is very telling within the context of what we're living now. And it's like, you know, how long has this been in plans? Like,
I agree. Looking back, you can see a lot, like we're seeing just kind of a culmination of a lot of kind of corruption in a lot of systems, or some problems with those systems that have now just they've been unmasked, right? They're showing their full-blown face, right? In schools, like teaching children to be afraid of other kids, not like you see pictures of daycares where they put them in like circles, right? You're not allowed to go near other kids and cover their faces, like at age of 2. Like that's just
like crazy. You can't do that to kids.
It's something that was kind of there a little bit before, but yeah, now it's just like, okay, clearly this is abuse. And
Yeah. Well,
like, yeah,
it's a weird thing about where it's like you're guilty or you're innocent until proven guilty. But in this situation, we're sick until
yeah,
proven healthy, right? And
yeah,
that's
yeah,
not a way to live. And we can't
yeah.
do that.
So yeah, I think the point that I was kind of bringing up is that I think the answer is that these institutions are, in my mind, I see them all crumbling. The healthcare institution is crumbling, the education system is crumbling. And so I think the solution is to kind of decentralize power quite a bit. And that's what I'm seeing, like a lot. I don't have kids myself, but we have quite a few friends, and they're all homeschooling their kids.
Yep.
And
Yeah,
or
there's a
they're
lot of
getting
that.
together in groups to be able to do that, so that they have that power and they can give their children that flexibility to be able to learn, but without that kind of rigid control system that clearly now is abusive in a lot of schools.
Yeah.
But I don't think homeschooling on its own necessarily needs to be what all of society does, but definitely there needs to be a lot more parental control over schools.
Yeah.
Right?
Yeah. There's a big movement talking about having the money that the government spends on a student. It's like $13,000 or something like that per student. You can move that. So like if you choose to homeschool, then you get $13,000 from the government to pay your educator. So you could hire a teacher, a tutor if you wanted to educate your kids if you don't feel that the school is doing
sounds
it,
like an
right?
excellent idea.
So yeah, I mean, like that's a simple solution, but they'd never do it because like the amount of people who would do it would be, I think, a lot, right? You get together with 4 or 5 people, and then
they lose control.
and then right, and things who knows what happens, right? Cats and dogs getting married. All right. Well, thank you so much I think we could wrap it up there. I think we've had a really great conversation, and my goodness, thank you for hanging out with me this afternoon. Is there any final thoughts? Anything you want to say? Where can people find you? I know that there's a GoFundMe to support your legal stuff. So
yeah, I appreciate it. Yeah, so I do have that, to kind of help with the legal fees, which are going to be pretty substantial. But yeah, if people want to follow me, I'm mostly on Twitter. It's kind of how I reach people. So it's at Dr. P_MD. So DRP _MD. I'm on Twitter, and my GoFundMe is on there as well.
Wonderful. I'll send me a link, and I'll put the link in the description so people can get right to it. So thank you again. I appreciate your time. We'll hang out in the green room. I'll sign off, and we'll hang out in the green room after. So thank you everybody out there for watching. And what's going on, I think, is crazy. What I'm trying to accomplish here is to have real conversations with people to get the temperature of what's going on and get unique perspectives. So I hope that this has been valuable for you. And it certainly was a wonderful use of my time. And thank you, Dr. Phillips, for hanging out with me. And everybody have a good day.
Thank you for having me on.
Wonderful.
Take care.